So one of the real key questions is if you have a patient who is PD-L1 more than 50% positive, should they have pembrolizumab monotherapy or should they have pembrolizumab with chemotherapy? And the question is specific to never smokers. If we look at the subset analyses data of KEYNOTE-024 and 042, the multivariable analyses tends to suggest poorer overall survival in the subset of patients that were never smokers with pembro mono compared to the outcomes of patients in KEYNOTE-189 who were never smokers with pembro chemo, where the outcomes were potentially better. We have performed real-world analysis looking at outcomes with the Flatiron database, where we were able to look at the real-world data in patients that had never smokers and look at prognostic impacts and take case mix adjusted patients and look at their outcomes. And when we look at those outcomes, we do indeed see in the real world what the trials have shown is that if you're a never smoker, the outcomes are poorer for pembro mono than pembro in combination with chemotherapy, suggesting that if you are a never smoker, perhaps the better approach is to have pembro with chemo, even in the more than 50% PD-L1 positive, compared to pembro mono.